One of the benefits of being in the United States is that we can benefit from the research and development that has been done abroad. And so it's really interesting when it comes to the EVO ICL, this technology was available for a decade overseas and over 2 million ICLs were implanted before it came stateside. And so our patients get the benefit of that research that's been done. And formerly, the two big issues people used to worry about before the EVO ICL came stateside was the incidence of long-term pressure issues and maybe early cataract formation. And of those almost 2 million implants that went in worldwide, there was very, very low incidence of either of those issues. And in fact, our own FDA studies show that in the 6 to 12 months after the EVO ICLs were implanted, the incidence of early cataract and long-term pressure issues was essentially zero.
I love how you're positive and you're thinking of the benefit of us getting access to this technology late, but I agree with you. I think it's really wonderful to have that safety profile before we offer this option to our patients. And I absolutely agree that the two factors that have been of concern are really a minor issue with the EVO ICL. Besides the low risk of glaucoma and cataract that has now been proven, there's also the idea of refractive stability. So patients who have had the EVO ICL, even in the higher corrections up to -16, when you look at these patients over many years after implantation of the ICL, their refractive error is holding steady at that point, which is very, very unusual. With corneal-based procedures, higher corrections especially, there is typically regression, there's remodeling of the cornea, and as a result, refractive errors tend to creep up on the patient again. Whereas with the EVO ICL, the patient can enjoy excellent vision for many years. The EVO ICL is also very biocompatible. The material is such that when it's implanted in the eye is unaware of its presence. And as a result, there's no scarring, no changes in the anatomy of the eye where the implant has been made. I have explanted the ICL many years after its implantation at the time of cataract surgery when the patient has developed natural aging of their lens and as a result cataract. And when I remove that ICL from the eye, there is absolutely no disruption of the anatomy of the eye. And when you look at the ICL under the microscope, it's as though it's a brand new ICL. So really that sits nicely for patients. And I love the idea that this is not going to cause any disruption or significant inflammation in the eye.
So those are all some of the great benefits, but I think maybe one of the best aspects of the EVO ICL is because of that central port, we no longer need to do the peripheral iridotomies. And so we don't need to make a small hole in each of the patient's irides. And that just leads to a much smoother patient experience overall, and maybe even has reduced long-term the incidence of glare and halos after surgery.
So the EVO ICL has a strong track record of over 10 years and over 2 million implants worldwide, and excellent results and very, very low risk with great outcomes.